Thank you for being here with me today. My name is Nancy Pusateri, and I'm the author of Rising Up. I truly believe that we can break free from the darkness that child abuse leaves behind. In this episode, I will be sharing important lessons I've learned on how to understand and heal from the lasting impact of abuse. I appreciate your support, and don't forget to follow and share this journey with those who might benefit from it. Healing from child abuse can be a challenging yet achievable journey that involves self reflection and revisiting past experiences. This healing path is rarely straightforward and often includes moments of progress and setbacks, alongside feelings of joy and sadness. Since healing is deeply personal, it's crucial to explore various approaches to discover what resonates best with you. Therapies that may assist in addressing childhood trauma include prolonged exposure, PE. Therapy is a structured therapeutic approach designed to alleviate the symptoms of post-traumatic stress disorder, PTSD, over time. By examining both PE therapy and PTSD, practitioners can evaluate whether this treatment aligns with their client's needs. Traumatic memories can significantly restrict an individual's life, often leading to withdrawal from social interactions and activities to avoid triggers. While avoiding these memories might offer short-term relief, experts in PE suggest that it ultimately exacerbates PTSD symptoms. PE therapy addresses this by encouraging clients to face these memories in a controlled setting, aiming for lasting healing. Research consistently demonstrates the efficacy of PE in reducing PTSD symptoms across a variety of traumatic experiences. Beyond PTSD, exposure therapy is also utilized for social anxiety and phobias, with benefits often persisting post-therapy. This overview will cover the components of PE, the techniques involved, and scenarios where PE might not be recommended. Understanding Prolonged Exposure Therapy, developed by Dr. Edna Foa and her team at the University of Pennsylvania. Prolonged exposure therapy is a form of cognitive behavioral therapy, CBT, that helps individuals confront traumatic memories and triggers. Unlike traditional counseling, where trauma might not be directly discussed, PE encourages clients to openly address their traumatic experiences, enabling them to process and regain control over their lives. PE typically involves 8 to 15 weekly sessions, each lasting about 90 minutes, and includes the following components. 1. Psychoeducation. Clients learn about PTSD and its manifestations. Educating clients about their symptoms empowers them to engage actively in their treatment. Psychoeducation is a well-established intervention aimed at arming individuals and their families with the essential knowledge, support, and strategies needed to manage mental health conditions effectively. Goals of psychoeducation: increase knowledge, deliver in-depth information about mental health conditions to enhance understanding, improve coping skills, cultivate self-management strategies to tackle daily challenges more effectively, enhance communication, foster better interactions between individuals and their support systems to promote collaboration and understanding, reduce stigma, promote recovery by clarifying mental health issues and diminishing associated stigma. Methods of psychoeducation: individual or group therapy. Participate in personalized or group sessions to discuss symptoms, treatment options, and resources. Workshops and seminars. Join educational sessions that focus on specific mental health topics. Online resources. Utilize trustworthy information and support via digital platforms like websites, videos, and apps. Family education. Engage family members in the process to equip them with the necessary skills and knowledge to support their loved ones. Benefits of psychoeducation: Enhanced understanding. Achieve a deeper understanding of mental health conditions, aiding in more informed decision making. Strengthened coping mechanisms. Formulate effective strategies to manage stress and anxiety. Reduced stress and anxiety. Experience decreased stress levels through better understanding and coping skills. Improved treatment. Adherence. Foster commitment to treatment plans through informed education and support. Increase social support and well being. Create a nurturing environment that bolsters overall well being. Psychoeducation acts as a vital tool for individuals and families facing mental health challenges. By imparting essential knowledge and skills, it empowers them to manage their conditions more effectively, ultimately improving their quality of life. 2. Breathing retraining. Clients practice relaxation techniques such as diaphragmatic breathing to manage anxiety symptoms. Techniques like 4, 7, 8. Breathing, bubble breaths, and box breathing are taught to aid relaxation. Breathing retraining exercises can help improve quality of life and reduce healthcare costs for people with asthma. Here are some breathing retraining techniques you can try. Diaphragmatic breathing. While sitting or lying down, place one hand on your chest and one hand on your belly. Inhale slowly through your nose while counting to 2, and feel your belly move out. Exhale slowly through your mouth while counting to 4, and feel your stomach move in. Box breathing. Inhale and exhale slowly while counting to 4. Nose breathing. Inhale and exhale through your nose. Breathing through your nose can help filter out allergens and dust. Soothing words. While exhaling, say a word like calm or relax slowly. You can try practicing these breathing exercises several times a day for 10 to 15 breaths each time. You can also try increasing the length of time you practice and how often you do it. 3. Imaginal exposure. Clients revisit traumatic events in detail, either verbally or in writing. This is recorded for clients to listen to outside sessions, helping them desensitize to the trauma and reduce emotional reactivity. Imaginal exposure is a therapeutic technique commonly utilized in cognitive behavioral therapy, CBT, to help individuals actively confront anxiety-inducing thoughts, images, or narratives. It is particularly effective in treating various mental health conditions, such as post-traumatic stress disorder, PTSD. Imaginal exposure is a central component in PTSD treatment, enabling individuals to revisit and process traumatic memories with the aim of reducing their emotional intensity. Obsessive-compulsive disorder, OCD. This technique helps address intrusive thoughts by encouraging individuals to confront and diminish their power over time. Generalized anxiety disorder, GAD. It assists in managing anxiety by addressing fears associated with worst-case scenarios, helping individuals to face and lessen their impact. 4. In vivo exposure. Clients engage in real-life activities that challenge their fears, such as attending social gatherings. This exposure is planned collaboratively, ensuring it's manageable and paced according to the client's comfort. In vivo exposure is a key technique in behavioral therapies, like exposure and response prevention, ERP, designed to help individuals gradually overcome their fears and anxieties. This approach involves confronting real-life situations that trigger phobias or distressing experiences within a secure and supportive setting. How in vivo exposure works. Gradual exposure. Starting with less intense feared stimuli, individuals gradually face more challenging scenarios, which helps build tolerance and confidence. Response prevention. Individuals are encouraged to resist the urge to avoid feared situations and remain in them until their anxiety naturally lessens, promoting coping skills. Habituation. With repeated exposure, individuals learn that the feared situations are less threatening than they initially seemed, leading to a reduction in anxiety over time. The primary goal of imaginal exposure is to relieve anxiety symptoms by weakening the connection between anxiety provoking thoughts and the subsequent anxiety. This is achieved through processes like habituation, where repeated exposure leads to reduced emotional reactions, or inhibitory learning, which involves developing new associations that counter previous anxiety responses. In practice, imaginal exposure therapy involves a therapist guiding the client through a detailed recall of an anxiety inducing scenario or traumatic narrative. Clients are encouraged to immerse themselves fully in the imagery and process their emotions. The therapist may prompt the client to repeatedly revisit the memory from the beginning, which helps to gradually decrease the anxiety response and empowers the client to gain control over their memories. Benefits of in vivo exposure: effective for anxiety disorders. This method is particularly useful in treating anxiety disorders, including phobias, social anxiety disorder, and post traumatic stress disorder, PTSD. Real world experience: it provides practical experiences that are more impactful than imaginary exposure, helping individuals confront fears in everyday settings. Coping mechanisms and confidence. Through in vivo exposure, individuals develop effective coping strategies and gain confidence in managing their fears. Examples of in vivo exposure: fear of heights. A person might start by standing on a low balcony and gradually work up to higher places. Social anxiety. An individual may begin by having brief interactions with strangers and progress to participating in larger social gatherings or public speaking. Important considerations: professional guidance. It's essential that in vivo exposure is conducted under the supervision of a qualified mental health professional to ensure safety and efficacy. Supportive environment. Individuals should feel safe and supported throughout the process to maximize the benefits of exposure. Individualized progress. The exposure process should be customized to match the individual's comfort level, ensuring a gradual and respectful progression. In vivo exposure is a significant tool in behavioral therapy, enabling individuals to confront their fears directly and lessen the hold anxiety has on their lives. Prolonged exposure techniques. PE also involves cognitive restructuring to help clients identify and counter negative thought patterns that stem from trauma. This is particularly effective when combined with exposure therapy in reducing PTSD symptoms. Additionally, teaching clients relapse prevention strategies, like recognizing warning signs and setting personal goals, fosters long-term resilience. Contraindications. PE is not suitable for everyone. Clients with a high risk of suicide or those with co-occurring psychological disorders, e.g., bipolar disorder, severe depression, may require alternative treatments due to safety concerns and the potential for increased distress. Conclusion: though initially daunting, prolonged exposure therapy offers a structured approach to addressing trauma, with research supporting its long-term benefits. By providing education and support, therapists can help clients develop robust coping skills, leading to significant reductions in PTSD symptoms. Trauma-focused cognitive behavioral therapy, TF-CBT. This therapy supports both children and their parents. Children learn to articulate their experiences, cultivate coping mechanisms, and adjust their thoughts and emotions. Parents gain insights on how to support their child at home. Eye movement desensitization and reprocessing, EMDR. a therapeutic approach designed to help process and integrate traumatic memories. Dialectical behavior therapy, DBT, focuses on teaching skills to manage emotions and improve interpersonal relationships. Play therapy uses play as a medium for children to express their feelings and work through trauma. Attachment-based therapy explores and strengthens the emotional bonds between children and caregivers. Somatic experiencing addresses trauma by focusing on bodily sensations and the body's natural ability to heal. It's vital to remember that it's never too late to start healing. Here are some tips that might be helpful. Schedule regular sessions. Consistent appointments can provide a safe space for processing emotions and maintaining progress between sessions. Join a support group. Connecting with others who have had similar experiences can offer comfort and understanding. Express your feelings. While it might feel uncomfortable to discuss the abuse with a counselor, opening up when ready is an important step towards healing. Each person's journey is unique, and finding the right combination of therapies and support is key to navigating the path to recovery. Rising Up is now available on Amazon. Child abuse is a harsh reality, and in this book, I share my personal experiences from the perspective of a child, giving insight into what it truly feels like to be a victim. Thank you once more for your support, and may you be blessed. I appreciate you tuning in today, and I sincerely hope that this episode provides support to those dealing with trauma, reminding them that there are paths to healing. Reach out to your healthcare provider to explore the resources available to you. Remember, you are not alone in this journey. This has been Rising Up with Nancy Pusateri.